thank you all so much for joining us today. For those of you that have not joined a webinar of ours before, I will give a quick introduction to our program and our staff. My name is Jessica Jones, and I am the program manager for the Mountain Plains Rural Opioid Technical Assistance Center. On the call with me, I have our administrative assistant, Margie Deanda, and our project director, Bobby Perkins. You will see things from all of us if you do sign up for our mailing list. We would love to have you on it. You'll hear about other events like this. A little bit about our program. We provide training and technical assistance that pertains to opioid and stimulant misuse across Health and Human Services Region 8. That includes Colorado, Montana, North Dakota, South Dakota, Utah, and Wyoming. Our focus is rural areas, and our audience is really more general. There are other programs that are very clinician focused, which we of course are always, we always welcome our clinicians as well, but we're excited to see a lot of you that are not from clinical backgrounds, and we are really excited to share this information with you. We want to go ahead and kick it over to our partner. USU Extension is going to be providing this presentation today. And before I kick it over, at the very end, we would really appreciate you filling out a survey for us. Margie will be putting the link in the chat. We are a grant funded by SAMHSA, and this is a survey that really helps let them know how we're doing. So without further ado, I am going to go ahead and kick the mic to Gabby.
Awesome. Thanks, Jessica. Thank you, everybody, for joining. We're super excited to be able to present on this topic. I wanted to do just a really quick introduction of who we are, and then I'll kick it over to Ashley to get us started. But my name is Gabby, and I'm joined here by Ashley and Aaron. Ashley and I work with the HEART Initiative, which is the Health Extension Advocacy, Research, and Teaching Initiative at USU Extension. We work in addressing opioid overdose prevention, recovery, those kinds of efforts around that topic, and other types of public health issues. And then Dr. Aaron Hunt is from the Department of Kinesiology and Health Science, and he's also an extension specialist. So he's a professor at the university level. Ashley and I work more on at the county level, but we all do work in substance use prevention and overdose prevention. So so let's go ahead and get started. I'll just kick it over to Ashley to get us going.
Thanks, Gabby, and thanks everybody for joining us. We have a lot to talk about today, so we just wanted to give you an overview of the path that we're going to go on. If this is your first time attending something like this as an educator or as someone else who is not as familiar, we're so glad that you are joining us and taking the time to learn some of this background information on fentanyl and some of the consequences, what overdose looks like, some of the things we can do to respond to an overdose. And then we're going to talk about some current trends from the Youth Risk Behavior Survey. And so we'll talk about that, like what's actually going on in the schools and with youth. And we'll talk about the do's and don'ts of addressing and preventing substance use and utilizing different evidence-based prevention strategies. That's really key because you want to do things that work, right? And so we're going to talk a little bit about that. And I know there's a second part to this that you will dive even deeper into that in. And then we'll talk about briefly some campaigns, toolkits, and other resources that you can use. We have a few different resources that we'll share at the end as well. And before we started, if this is new, we just wanted to give you a brief warning that the following slides do depict images and discussions of illicit and prescription opioids and signs of overdose, steps for response, and that type of material. So if you find any of the images or discussions uncomfortable, feel free to excuse yourself at any time by turning off or looking away, stepping away from your computer, closing your browser, or muting your screen. We will understand. So to get us started, just the basics, right? What are opioids? You've probably heard this a lot because there is a opioid overdose epidemic. That might be a word that you've heard a few times. So talking about opioids, they're really a specific class of substances that are commonly used to relieve the feeling of pain, but they can also include illicit or illegal substances as well. So like heroin would be an illicit substance, whereas you have prescription pain medications as well. Both of these actually bind to the same receptors in your brain that respond to opioids and alleviate pain. And so those symptoms of pain will be alleviated short term. And so prescription painkillers that you might know or have seen include things like oxycodone, Vicodin, hydrocodone, Percocet. Tramadol is one that I think a lot of people don't know is an opioid, but it is. And methadone is an opioid. There's also things like codeine that have opioids in them. Demerol, fentanyl is an opioid, and Tylenol with codeine. Anything with codeine also has an opioid in it. And then we also put some illicit substances that have opioids. So heroin, opium, and fentanyl-laced substances, including things that might be contaminated without the person knowing that there's an opioid or fentanyl specifically in the substance that they're using. So sometimes cocaine or methamphetamine or even marijuana can be contaminated with fentanyl, which is why it's so important when we're talking about youth to also talk about fentanyl and noticing the signs, because they could be using a different substance, not even aware that there's fentanyl in the substance they're using, like marijuana or a different substance. So this is really good information. And, you know, these are really commonly used, the opioid pain medications. And especially at end of life care, terminal pain is managed really well with short-term opioids, but long-term opioid use actually can have the opposite effect and increase your sensation of pain. So it's important when we're talking about opioids and prescription medication, and we're not going to talk a lot about this today, but to be aware if you are taking an opioid or know people who are, or youth, that those are really meant for short-term pain treatment for most people in most circumstances. And so alternative pain management strategies also are effective and work. And I'm sure you'll have lots of other opportunities to talk about alternative pain management. When we're looking at fentanyl specifically, we're going to talk a little bit about what it looks like. We're going to show some different images. And fentanyl is, again, just a synthetic opioid. It's an analog of a pharmaceutical fentanyl. And you can see here on the right what a visual dose of heroin, fentanyl, and carfentanil would look like that would kill an average adult, resulting in a fatal overdose. So you can kind of see the potency or the power of each one is different across the three. And so it's 50 times more potent, fentanyl, than heroin. It's commonly used as a liquid or powder form. It can be standalone or it can be mixed with other substances, like we mentioned briefly, that sometimes without people even knowing fentanyl is in there. And carfentanil is the most common form in current supply. And so we just wanted to talk briefly about the pharmaceutical fentanyl, which was approved by the FDA. It was developed in 1959, so it's been around for a long time, prescribed to treat very severe pain after surgery or terminal illness, such as cancer. And again, there's different ways that people can ingest or take fentanyl. That can be liquid lozenge or a patch on the skin, a pill, or even a nasal spray. And it's 100 times more potent than morphine, 50 times more potent than heroin. And carfentanil is actually 10,000 times more potent than morphine. So 100 times of pharmaceutical fentanyl, 50 times that of heroin. So it was synthesized originally, carfentanil, for use with large animals, which is why it's so much more potent if we're talking about that potency. And we just wanted to give you this background of, you know, what is illicitly manufactured fentanyl? What are we talking about here? And this is kind of what it can look like. It can look like any of these different things. The most common forms are liquids or powder, but again, like it can come in different forms as well. Lollipops, nasal sprays, patches, lozenges that people have in their mouths. So some of the street names that maybe you would hear as you're looking at fentanyl could be white heroin, Dirty 30, China White, Red Rum, Goodfellas, Right Friend. There's different names that people have come up with to describe these things, so they're not saying the word fentanyl. And the powdered fentanyl on a pencil tip is that one on the far left here. Then you're looking at counterfeit oxycodone tablets, also called M30s. The issue is that some people might not know that the medication or pills that they're buying from someone illicitly have fentanyl in them. So they might be buying a medication that they've taken before, but it happens to have fentanyl in the pill and they're unaware of that. And so that can also lead to fatal overdose. And then on the right here, multicolored fentanyl pills as well. So this is just a few depictions of what fentanyl can look like. And these are all from the DEA. And fentanyl is dangerous because a really small amount, 2 milligrams, can cause an overdose. And that's just a lethal dose of fentanyl compared to the size of a penny right there on the right. And so it's hard because you can't see it, you can't smell it, you can't taste it. So people often aren't even aware that they have ingested fentanyl. And, you know, there's an unknown amount across different substances, whether or not people are aware, because of the way that substances are mixed or sifted together for the illicit manufacture of pills, right? Different amount goes into different ones. It's not ordinated. It's not in any specific amount. So it can, one pill might have a very small dose, another pill would have a lethal dose, and they could look exactly the same. Analogs don't show up on traditional toxicology screenings, so that makes it hard to detect these things if people are doing urinalysis. And the tolerance, again, is different for everyone. So some people who have never taken an opioid, that would result to a higher chance of overdose than people who have been taking opioids. And so just recognizing that if you have a youth who's unaware that they're ingesting fentanyl, or someone around that is not aware of this, that could lead to very serious overdose and symptoms pretty quickly for that person if they're not taking opioids. And I'm actually going to pass it over to Aaron, who's going to talk about the signs and symptoms for us of an overdose.
Thanks, Ashley. Yeah, so I'm going to jump in, talk about signs and symptoms of opioid use and then signs and symptoms of overdose. So this slide is more covering what opioids do to your body. So opioids do have a medical effectiveness or purpose. So if you've had surgery or pain, you might have been prescribed opioids because they do certain things to our body. The main thing they do is reduce pain. So opioids block pain receptors in our body to limit the impact of pain. In our brain, opioid receptors really regulate our pain perception, emotional memory, reward, and pleasure sensations. And this gets into why opioids can become so addictive. A lot of people with trauma or other past pain issues, the opioids really help block those. It's not only physical pain, it can be emotional pain, trauma, things like that. And the problem with opioids, and especially fentanyl, is that they're pretty powerful depressants on our body. So you can see on this slide, they really slow down our central nervous system, and eventually they impact our breathing. And that's what a lot of deaths are caused. If you have too many opioids blocking these or on these receptors in your brain, you're going to stop breathing. But when we're talking about also the pleasurable impacts of opioids that, the high people get, they do cause some euphoria in the body. It can cause you to feel warm, drowsiness, like just feel happy. So there's all this mix of things going on in your body, but the point is too many opioids will decrease or stop your breathing, and that's when you go into overdose. And if no one responds, that's when the person can eventually die or have negative consequences. Ashley, can you go to the next slide? Thanks. Perfect. So as a group, we do want you to be able to recognize some of the key signs of an opioid overdose. And it relates to kind of what we were talking about, the breathing. But first, a person might be non-responsive. You come up to a person, hey, are you awake? Try to shake them. If they don't respond, chances are they could be overdosing on an opioid. They will have slow or stopped breathing. Again, opioids really impact your ability to breathe if you have too many. So if a person's not breathing, they're struggling breathing. The next one's kind of that gurgling or choking sounds. They're really having difficulty breathing, and then turning blue or purple, that next picture. Those are kind of the tall tale signs of an opioid overdose. So if you see any of these, you can kind of assume it's an opioid overdose. Some of these are similar to alcohol poisoning, but we're going to get into Narcan, which is a drug to treat this, but it doesn't have any side effects, so you can still use it. Perfect. So this next slide are the steps to respond to an overdose. Oh, I did want to touch one thing. Ashley, can you go back? So if a person has like darker skin tone, it might be harder to tell if they're turning blue. But you can look on their lips or press down on their fingernails to kind of see. And then you can feel their skin and these other things. But these are the key signs just to be aware of. So hopefully, if you're ever in a situation, you'll be able to identify a few of these signs. The pupils, small pupils, we don't really want untrained people trying to open up people's eyelids to check for the pupils. This is more for like EMS. So that one is a sign and symptom, but we kind of recommend not focusing on that one because we don't want poking people in the eyes, things like that. Just focus on the other ones, the breathing, turning blue, unresponsiveness. Those are kind of the key ones. Perfect. And Ashley, we go to the next slide. Perfect. So I did want to cover the steps to responding to an overdose. And maybe a lot of you have had a Narcan or naloxone training, and that's what we're going to talk about here. But the first step, if you see someone who looks like they have a sign or symptom of an opioid overdose, you are going to want to, one, go up and try to wake them up. And we recommend doing a sternum rub. So you can see in that picture, they're rubbing, right in the middle of their chest. And normally a person will respond to this if you rub hard enough. So this is a good test to see if they'll be responsive or not. So you can say, hey, are you okay? If they don't respond, rub their sternum hard. And if they don't respond and they have some of those other symptoms, the breathing problems, turning purple, they might be having an opioid overdose. So once you've identified they're unresponsive, potentially having an overdose, the next thing you want to do, obviously, call 911. We do a lot of trainings with the community and with people who use drugs. And sometimes they're hesitant to call 911 because they don't want their friends to get into trouble. Oh. Can you still hear me?
Yes.
Perfect. Yeah, so definitely call 911. Recommend your students call 911. It's better to call 911 and save someone's life than to avoid your friends or your students getting into trouble. And a lot of states have Good Samaritan laws that protect the people from getting into trouble for having drugs and things like that. So after you checked for awareness, call 911. Then step 3 is to administer a drug. It's a nasal spray, usually called Narcan or naloxone. And what this drug is it blocks opioid receptors in your brain, so it stops the opioids from working on the body temporarily. This doesn't last forever, but it should eventually, if they have enough of this drug administered, it will block enough of those receptors and it should stop the overdose. With fentanyl and carfentanil, these super strong opioids, unfortunately, sometimes you have to give multiple doses of this to get the person's overdose to temporarily stop. And if you get Narcan or naloxone in your state, this should be over the counter here pretty soon. Like you be able to go into any pharmacy or Walmart or kind of anywhere and buy this any day now. but lots of states give this out for free. But when you get a dose of this, it's usually 2 nasal sprays. So you'll have 2 doses to give people. And lots of school nurses have this. So if you're a teacher or educator, that might be where it's stored at your school. If they have it, some places have it on the wall. So this is the drug we want people to administer to people having an overdose. So here's the main 3 types of Narcan, and you can inject Narcan or naloxone. It's kind of the same name, just different brand names for the drug. But primarily you'll see this nasal spray because people are most comfortable doing that. Not everyone wants to do an injection. And then that atomizer does kind of an automatic injection, but those are more kind of expensive. So you'll see the middle one, it's a nasal spray. So like I was saying, you might want to give 2 doses, and you want to wait about 3 minutes between the first and second dose, or 2 to 5 minutes. If the person does not wake up or come out of the overdose, always give the second. And then if the second one doesn't work, hopefully the ambulance, you've already called 911, will show up and be able to administer more doses if needed. You can go to the next slide. So once you've administered the Narcan, your job's not done. Like I was saying, for the impact of opioids impact your breathing. So Narcan won't always wake someone up, or they won't start breathing right away. And it's pretty important to do CPR. We're not going to go into lots of details. This isn't a CPR course, but we always want to at least touch on chest compression only CPR. There's a lot of research showing you don't have to give any breaths. So let's say you don't feel comfortable, you don't have a mask or a barrier or something. Just doing chest compressions is effective to keep people alive, especially if you do it until EMS shows up. So when we do chest compressions, people don't realize how fast you have to do these unless you've kind of done a CPR training. So, and you have to push pretty hard. So you want to do about 100 to 120 compressions per minute. And if you're all familiar with the Bee Gees song, Staying Alive, if you think of the beat to that, the ha, 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 staying alive, that's kind of the rhythm you want to do. It's really fast. You want to push really hard. And this can potentially help this person survive their overdose. So we always recommend, doing the chest compressions. We don't always recommend doing the breathing if you don't have a barrier, things like that. But if you do know CPR, or there's 2 people available during an overdose, you are welcome to do CPR. And every about 30 chest compressions, you want to do 2 breaths. So if there's 2 people, you can do that. And then once the person does wake up, we want to put them in a recovery position. The other thing to note is when you administer Narcan, you're immediately putting the person into withdrawal from opioids. So if they're a long-time opioid user, they're going to feel horrible. They might, throw up. So we want to put them in this position. And the next slide, shows how to put them in. Let's say you're by yourself. If you want to go to the next one, if you're by yourself responding to an overdose, you want to lift their arm up, roll them over on the one side, pull their knee out so they don't roll all the way over on their belly, and kind of get them in that resting spot. So if they do throw up or anything like that, it's not going to go back in their airway. And then just stay with this person. You want to kind of stay behind them too, just for your safety. Sometimes you don't want to get thrown up on and things like that. You can sit behind them, wait for EMS. So this was kind of a quick overview to responding to an overdose. If you have questions on this, and lots of states do full trainings, but the point is, we're hoping you all get Narcan, carry it with you, or have it at your schools. And depending on your state and laws, things like that. But carry it. The other thing to note is that what if the Narcan doesn't work? So people can overdose from methamphetamine, cocaine, Adderall, alcohol, Xanax, these other things that aren't opioids. But we always recommend giving Narcan because it's super safe. All it does is block opioid receptors. So if I was going to inject Narcan or, inhale it right now, it wouldn't do anything. It won't hurt me. So we always recommend giving it for a number of reasons. One is lots of people use multiple substances. So they might be using opioids and meth, and opioids or, other things. So definitely always, if you have Narcan, administer it because it won't hurt the person. And then another reason Narcan might not work is because they might have lots of opioids or very strong opioids in their body. Like we talked about the fentanyl being, up to 10,000 times as strong as heroin or morphine. So the amount of doses you give might not be enough to reverse the overdose. And that's when you definitely want to do the chest compressions until the EMS arrives. And then recently we're seeing this drug called xylazine, which is an animal tranquilizer. It puts people to sleep, and people use it to kind of expand the high from the drugs they use. And the important thing to know, this might make it seem like the Narcan's not working, even though it is working, because they won't wake up. They may start breathing, but they won't wake up. So if the Narcan doesn't work again, the point is just do chest compressions, wait for the EMS to arrive, and always call 911. And I see some questions. I'll try to answer some of these in the chat, and then we'll kind of come back to those at the end, but I'm going to turn it over to Gabby.
Okay. Yeah, thanks. Okay, yeah, I saw a couple of questions in the chat and tried to respond to them, but Ashley and Aaron, feel free to respond as well. And I did see that there is a somebody was talking about making naloxone kits and having, kind of sharing those out. So that's a really great way to get it out into the community. But to kind of continue with the presentation, we talked about kind of an introduction of fentanyl, this analog of carfentanil, kind of how, what it looks like, kind of looking at those signs and symptoms of use, also of an overdose, how to respond to that. But really what we're trying to get into, kind of laying this foundation is, what does this look like among youth? What are these current trends among youth? And so just because we do have folks from multiple states, we're sharing national data. And so these results are from the CDC's Youth Risk Behavior Survey, or what we kind of know is the longer title, maybe the Youth Risk Behavior Surveillance Survey, the YBRSS. It's just such a long name. But anyway, so we're looking at the Youth Risk Behavior Survey. And so I wanted to, if you're not familiar with it, there is a link in the references at the end for you to be able to go and check it out on the CDC website, those reports. But if you're not familiar with it, just wanted to give you a bit of a background on that. So this survey is voluntary and it's anonymous. It's conducted every other year on odd numbered years. And it's only conducted of students who are in grades 9 through 12, so those high school ages. The most current data we have is from 2021, because whether you are aware or not, normally federal level data, national level data takes about 2 years to really compile, evaluate, analyze, and get the report out and all of that. So that's why the latest one is like 2 years old. But in 2021, nationally, there were about 152 schools that participated, and they had about 17,200 plus responses. So it was, and it seems to be, at least from the reports, if you look at the trend, the number of responses seem to be pretty normal, or pretty like around the same every time that this is administered. But they do it in different schools, different states, different regions. And this includes public schools, private schools, charter schools, tribal schools. So they have a pretty big representation, or they try to get a pretty big representation. The survey itself measures health-related behaviors and experiences. So these are things they look at: school and community safety, school and community connection. So how connected are you to their communities and their schools? How safe do they feel in their communities and schools? They look at healthy behaviors such as healthy eating, physical activity, sleep. They look at substance use and mental health questions. And this is kind of new, actually, in the history of this survey. These haven't been there forever, since the beginning. They look at housing, the housing situation for the youth, their exposure to violence in their communities and at home, and also looking at parental involvement and parental monitoring of their behaviors, of the things that they're doing, of their activities and stuff. And these are really good. This is a good thing to use, especially if you're in a state or a county that doesn't collect this data more on the local level, or you want to look at local trends versus these national trends, what it's looking like nationally. These results really help monitor those health trends and identify those emerging issues that we can see nationwide. And so if you are a coalition or a school or an organization that is working with youth and wants to conduct programs or promotional messaging or things like that, then this kind of data can help them, you plan and evaluate those programs to see their effectiveness, kind of looking at improving that adolescent health. Okay. So this next slide, these are just screenshots from basically just one page. The next two slides are going to cover just what we're talking about here. So the left, if you look at the left side, that image had asked the students, have you ever misused prescription opioids? So lifetime use, basically looking at that lifetime use. And versus the right side is looking at misused prescriptions during the past 30 days. So in the 30 days of taking the survey. And so you can see that in 2021, 12% of high school students reported ever taking a prescription pain medication. And by misuse, they mean that they used it without a prescription, or they used it differently than how it was prescribed. So even if it was prescribed, did they use it as it was prescribed? Did they kind of not do it that way? Or did they just completely just use it without a prescription at all? In 2021, 6% of high school students reported using it within the past 30 days. So you can kind of see those numbers. And then you can see just by looking at those as well, female students who identify as LGBTQ, and students with same-sex partners reported higher use. And this was among all substances. So not just opioids, but also things like alcohol, tobacco, vapes, and other substances. And I wanted to say specifically LGBTQ because the 2021 survey didn't have questions about gender identity. So the report doesn't really highlight data of students who might have identified as transgender. Now, I'm saying that specifically because in these next surveys, so after this one, so I guess would be this year, the 2023, and going forward, they are having questions. They include questions now about gender identity, so they can look at and kind of parse it out a little bit more, within certain demographics and certain populations. There are also, you can see racial and ethnic differences that regard certain substances, so you can kind of see what it looks like as far as that national data. Okay. Next slide, please. Okay, thank you. All right, this next slide is another screenshot from the report. And this really looks at the kind of what I wanted everybody to see here is just what does prescription opioid use look like in relation to other illicit substances, in relationship to vapes, using vapes, marijuana, and alcohol. So the survey asked about all of these substances, and then they put it into this kind of looking at, again, those trends from 2011 all the way to the latest report or to the latest data. And you can kind of see just overall these substance use did decrease for most of the substances, but otherwise in other instances it did not change. The use didn't really change much. Now the numbers obviously, when you can see like vape products, 2019 was 33, 2021 was 18, you're like, but that's going down. That's like a lower number. But when you look at the data, when you look at the specific numbers, then that's why it really hasn't changed, because they're looking at that kind of total, looking at all of those years for the past 10 years. What does the trend look like? You can also see that data is missing for some of the years, and it's just because the survey in those years, the survey had not asked those questions about those particular substances. And so that's why there's no data, especially for the opioids and prescription opioids. Early on, there really wasn't much data until there was that kind of looking at that national level, those trends, right? The crisis that had been happening, the opioid overdose crisis, and then what it's looking like among youth. So that's why they started including the questions in there about that. Okay. One of the big things I wanted to say about this before we continue is that, again, this is nationwide data. So look at your state and county's data to get more accurate local, to get a more accurate and local picture. So, for example, does your county or state administer something like their youth risk behavior survey, right? So, for example, in Utah, there are counties that can voluntarily take what's called the SHARP survey every other year. And it asks really similar questions, and this is given to students in 6th, 8th, 10th, and 12th grade. And so we have that data. Now it's not perfect, and there have been some issues, like some politics about taking, asking students and young people these questions. So there are some counties or some school districts that might not be administering this, or because it is voluntary, not every school district has to participate, and so kind of from year to year there could be lower numbers. So, but it still might paint a pretty good picture of what's happening at the local level if you're experiencing those kind of similar challenges. But if you are a school district or in a school district and you come across something like this, if you have a voluntary survey that students do take, just understand that asking these questions does not implant the thought in their head. It does not implant the idea that, oh, maybe I should try it now. It does not do that. Also, local coalitions, utilize this type of local data to be able to get funding and continue to have funding, because with their funding partners, that's one of the requirements can be, look at your local data. What is that data? Do you have programming or some kind of something that'll help to address this? And then did that work? And so having these kinds of surveys can be helpful in looking at whether some kind of a campaign or some other kind of intervention may have contributed to decreasing or staying the same, or whatever change that is seen, And so if you are in a place where you are able to kind of advocate for administering this among students, work with your coalitions, work with your local coalitions and organizations to see how this can be administered with your students. And then you can compare it. There's also monitoring the future. That's what the SHARP survey compares it to, is monitoring the future. And it's very similar. That's a national level. Survey as well that looks at substance use behaviors and attitudes among youth in 8th, 10th, and 12th grade. So at least the SHARP survey compares it to that, because it has very similar questions, if not the same. So, but you can also use the CDC, this YRBS survey. Okay. So where do youth get fentanyl? And, not only where do they get fentanyl, but where can they get opioids, or where can they get these illegal substances? And the DEA they have a campaign called One Pill, or One Pill Can Kill, kind of their message. But basically, on the website, they have a lot of great information that you can go to. And I think we have a slide later on that, and so Erin will talk about this a little bit more. But so the DEA identified 3 overarching areas or ways that youth are getting counterfeit medications, counterfeit pills, and fentanyl, things like that. So first way is social media. We have drug traffickers use social media to advertise drugs and do sales. So if you've been listening to the news the last couple of months, you might have heard things like people using Snapchat to find ways to buy substances, things like that. Not calling out Snapchat specifically, but just saying like that's one of the things that came to mind recently. So it's really important in this case to educate students about the potential risk of buying these drugs on social media, right? So not using social media, not even if they have friends they have their friends who they would trust with their life, and and they've been friends forever. It's really kind of a dangerous place to kind of rely on social media to do that. Second one, you have these that they can be buying directly online from counterfeiters. There are sites that are available that offer sales with a prescription, whether the prescription is real or not. It could be a fake prescription that is being written. And so they're able to buy these online from counterfeiters. And then lastly, a youth might be using prescriptions that are left over in the home. So if you have a parent or a guardian that's in the house that had some opioids for maybe after a surgery or other procedure, and they had it in the house, then it's available. It can be available. And so in some instances, youth are getting it from those prescriptions that are in the home. And so this encourages that proper disposal. We want to encourage proper disposal. They are local pharmacies, police departments, and other agencies around different states and counties and things. They have drop boxes where you can do this. You can also get products that are like Deterra. It's I can't remember what that is. What is the RX? Yeah, Dispose RX. Thank you, Caitlin. So Dispose RX, where they have things inside where you can put the opioid in there, and it'll deactivate. It'll kind of like mess things up, and it'll deactivate the compounds and things like that. So you can do that. You can also mix it in with like kitty litter and all kind of gross things. So to make it really gross and unappealing. So these are, there's also emojis. So if you happen to kind of, be able to check out a student's phone or just kind of see maybe randomly, you're able to see, then there are some emojis that do kind of specify or can show like that they might be talking about certain types of substances. Okay. Next. Okay. So now let's get into addressing and preventing substance use in your classrooms and schools. We're going to go through the do's and don'ts. This particular part of the presentation, we're not going to do a deep dive into it for now, because this is mostly about fentanyl and about opioids and kind of how to recognize it. So we're gonna do a little bit of the do's and don'ts, but the next presentation, kind of the part 2 of this, we're going to do a deeper dive into it. Okay, so we want you to come back if this is what you're super interested in. You're like, yep, please, I want more. Then please come back to that one that's in a couple of weeks, and I'll let Jessica and when those advertisements come out. So, all right. First, we're starting with the don'ts, because let's start with the don'ts. All right. Why do I have eggs on here? It's weird. But really, if you remember the days of those commercials, this is your brain on drugs, and somebody cracks an egg and it's frying in the pan and stuff, those days are gone. The days of just say no are gone, right? So those DARE campaigns where you just say no to drugs, those have shown to not work. And so we wanted to go over the don'ts. When you are making a campaign, when you're making a campaign or messaging or sharing this information with students and with youth in general, don't exaggerate or make up information. So one of the reasons that we are talking about this and we're giving you this information, and also we're showing the national data and those trends, is because it's important for people to know what, the correct information. We have access to the internet at our fingertips. So if a youth especially, even adults, if they think that you're making something up, they can look it up and find out the real information or the correct information or what they think is the correct information, right? So you don't want to exaggerate or make up information. You don't want to use scare tactics or over dramatize. Again, youth these days are exposed to so many things, so many challenges that are going on in the world, and and that's impacting, and that's another topic. But again, things that scare youth or that used to scare youth might not scare youth. And over dramatizing will just make it seem like, oh, you're just, you're dramatizing. They'll call you on it. They can see that. So it's important not to use scare tactics or over dramatize. Fear-based events and assemblies don't work in the long term. In the short term, like at the event or the assembly, it might arouse a feeling, like it might arouse fear or anxiety. It might have the students shut down, but long term, it doesn't really work. And this includes having a person go up and speak about someone who had been used, kind of went, to the brink and came back and is really is just, in a great place and super, like really doing well. And it's kind of a balance, because you do want to show people that there is hope. But when it comes to youth, what has been shown is that we're like, oh, I can start using substances and I'll be fine in a couple of years. So it's a little bit tricky with youth and kind of how that works. Don't rely on knowledge-based interventions. So so this one is specifically more about like, you don't want to just drop facts like 80% of youth, blah, 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 20% of youth, blah, blah, blah. X amount of this substance is gonna, cause an overdose. So you don't want to do just like straight kind of like facts and figures and data and stats. You don't want to focus on that with youth. Don't use morality as a deterrent. Like, it's just bad to use drugs. Don't use drugs because it's just bad. You don't want to do that. You don't want to hurt your family and friends. Don't use that. That's actually not, like, youth tend to kind of do the opposite of things like that. So morality doesn't generally work. And then lastly, if you, this is one of those things about don't group at-risk youth together, because this one is more about like, if you have a group of students together, let's say that you're working on projects together, or even maybe after school or something like that, you want to do a mix of youth who are, you don't want to put at-risk youth together, because that's kind of, you want to balance some positive influences into a group of youth, and it can help kind of balance things out with youth who are considered at risk. Okay, next. All right, so now let's go to the doodly do's. A lot more do's. We're going to end on a positive with this slide, okay? So we want you to understand when you are making campaigns, doing messaging, doing outreach, working with youth, sharing messages, all of that, do understand ages and stages. In the next couple of slides, when Ashley goes over the resources, we do have a link to a document. Cooperative Extension nationwide is in charge of a youth development program called 4-H. And one of the things that they really focus on, and they do a lot of like handouts and they write publications on, are ages and stages. So depending on a youth age or age range, what stage are they in developmentally, physically, cognitively, emotionally, mentally, socially? And so the document, helps you kind of determine if you are making your own campaigns and messages and kind of how to work with students, or even design activities in a classroom or at a school. Then you can get it's a nice guide. It's a really helpful guide to see like what would work with these students or with these youth of any age. Do you understand ACEs and PACEs? So these are these adverse childhood experiences, but also these positive childhood experiences. So not only being aware and understanding and knowing about adverse experiences, but really focusing on those positive ones as well, because positive childhood experiences can help counteract or kind of imbalance that, kind of counteract those adverse childhood experiences as well. And you want to integrate these into age appropriate activities. You want to encourage questions and discussions, right? So unlike what we're doing now, we're just basically talking, you guys, and we are answering questions along the way. But really, if you're, encourage these discussions with youth, encourage questions that they're asking. And obviously in your state or in your county or your district, there might be kind of awareness or, you got to understand your own climate and kind of what questions can be asked and what you can address. But understand that if a youth asks a question, really try to answer it honestly and openly, because if you can't answer the question, they'll find the answer somewhere else and the answer might not be correct. Okay, so be honest and direct, kind of talked about that as well. Do teach these practical and social, do teach and practice, these social competency skills, things like self-regulation as well. And this is all part of social emotional learning. And also focus and practice on academic skills. So things that they're doing well at school, or things that they really like to do, and you use that interest and those and their skills to focus in and use at the school. So one of the things I know with social emotional learning that might be an issue as well. The climate is a little bit iffy on that, depending on the state or the region. But that social emotional learning is really helpful as a youth, and then as they grow older and they start getting into work, they start getting into relationships and things. And we do, at the end of this, we do have a little video to just shamelessly plug SEL. But so we're going to show that really quickly. But let's finish up with the rest of these. Do focus on their strengths and normalize healthy behaviors. So as you could, if you remember back to the couple of slides ago, the use is not, it can, and depend, okay. So I want to say that's from a national level, but locally, when you look at your local data, then you might see locally that use of certain substances may not be as high as even the students think. So for example, in the SHARP survey, the youth are asked, how many of your friends do you think use, alcohol or marijuana or, drugs, substance, whatever. And youth tend to think that more of their peers are using it than they actually do. And then they're asked, how much do you use? And they always say that they use less, right? So do focus on also their strengths as well. So what do they bring to the table? What do they bring to their experience? Do they have skills? Do they have hobbies, interests and things like that? And then normalizing those healthy behaviors. Not everybody is using a substance. Not everybody is using substances. Some don't want to, even if they're surrounded by it, they may not want to. So normalize those healthier behaviors. Do engage students in creating these campaigns and posters. So if you're trying to reach youth, use them, involve them, in all of these types of messaging. And it doesn't have to be just the youth who are considered like leaders or in leadership positions at their schools, but really engage any youth, all youth to be included. Okay. And then lastly, yes, positive youth development as exactly. And then lastly, do focus on alternatives to substance use, not the substance use itself. So this is kind of like messaging, again, back to like, don't do drugs, right? Just don't do drugs. This is what they do. This is what harm they can do. This is what can happen in the future. But that is less effective than focusing on alternatives. So, looking at hobbies, extracurricular activities, after school projects, having them engaged in things that they can help with in the classroom, things like that are shown to be better than just focusing on what can't they do, what they should not do, rather than, you want them to focus on what they should do or what they can do, what they're capable of. Okay. Next. So that's, go ahead and go, well, yeah, let's do the video first, I guess, and then we can talk about the schools, at the school level. Let's see if we're able to.
It's not letting me share. Let me see if I can get it to work.
Let's see. Erin, do you have the link? Because I think you found the video. Because we can even show it, we can even share on YouTube.
Yeah, I have it.
One moment, please.
Can you see this now?
Yes.
Yep.
Perfect.
There's a lot of talk these days about SEL, social emotional learning. But what exactly is it? Social emotional learning is the process of learning social and emotional skills, and it's just as important as learning reading or math. This learning process is most effective when it begins early and continues through high school. Social emotional skills are essential for success in school, work, and life. With SEL, students learn to manage their own emotions and behaviors, have empathy and show care and concern for others, solve problems effectively, make responsible decisions, and maintain healthy relationships. Students learn to recognize what's happening inside them and to be aware of their emotions, which helps them deal with strong emotions and impulsive behaviors. It helps them stop, take a breath, and think about a situation before acting. Students learn to identify others' emotions and perspectives, which helps them empathize and show compassion, no matter who they are or what their background is. It's not difficult to imagine how this is important in the classroom and in life. Students learn to solve problems in peaceful ways and communicate assertively about what they need or want. This helps them get along with other students and get the help they need from adults. When students learn to make responsible decisions about their lives and their future, things can turn out better. Research shows social emotional learning makes a difference. Students who participate in SEL do better academically, have improved attitudes and behaviors and act in delinquent or disruptive ways less often. In the United States, students with strong social-emotional competence are twice as likely to earn a college degree and nearly 50% more likely to graduate from high school and have a full-time job by age 25. Just as important, students who are socially and emotionally competent have more friends. This means they're more likely to feel connected to school and do well, and less likely to be left out or bullied. Simply put, by participating in social-emotional learning, students learn the skills to succeed in every facet of school and the rest of their lives.
Thank you for playing that. Can we stop sharing that?
Oh, didn't I share the new one, Gabby?
No, I just still see the SEL. Is Aaron? Yes, yeah, we will. We will post, because it's a large PowerPoint, we'll share it as a PDF and we'll include the link on that slide. So under the SEL window, we'll include the link so you can just click on it. There we go. Awesome. Thank you. Okay. So what is the role of schools? What can you do? And thank you everybody for your comments, commenting and going, following along with us and engaging with us. And thanks for Ashley and Aaron for answering the questions. And we will definitely, if you still have questions at the end of this that we didn't answer, please, we'll have time for that. So the role of schools, we put this in here because we, in the positions that you're in, we don't want you to feel like you are alone or that you're expected to do this on your own, because there are coalitions, there are organizations. Every state has a cooperative extension service. So if you're like, hey, USU extension sounds cool because I, went to a presentation, well, your state has the cool cooperative extension service as well that is run through that state's land grant university. So you can always reach out to them. You can reach out to us to help make that connection because we have connections to that network. But really, the role of schools, there are a lot of things that schools can do, whether you're a school leader or a teacher or a staff. It's all about creating that safe environment and that positive environment and positive culture for students. So there is a document that came out. This was from the United States Department of Education, and this explains these a little bit more, but we just put it on here just to have them kind of these overarching suggestions. Educating students, each other, and families about the dangers of substance use. So for example, like what you guys are doing now, you're in you came to a presentation about fentanyl and looking at the how to address this in your schools. So educating yourselves, you're already doing it, and going, to any other types of professional development that you might have through your school district, but also including families and students about these issues as well. Talk about how to prevent opioid misuse and addiction. So as Ashley had said at the beginning, opioids have a place, and Aaron said, I think both. Anyway, opioids have a place in pain management, but it's a short term. It's something that is used short term, and it's not meant to be something that will used over a long period. So there is a time and a place for opioids for using them, but look at misuse. Look at the danger and the challenges of someone who might be misusing or using them, overusing them. Consider delivering evidence-based prevention programs in school settings. So we are going to share a couple of these resources, what evidence-based programming looks like, but also looking at, again, those ages and stages document and those things that we talked about can help you craft something as well. Mitigate those risk factors that can make students vulnerable. So looking again at those ACEs and those PACEs, creating those safe environments, basically, to make the schools a kind of a safe place. Boost protective factors, increase student engagement, so having students more involved in the schools. Students, at least in Utah, what we have found through the SHARP survey is that low school engagement and low school attachment is shown to kind of lead to increased substance use, or other types of challenges that related to like mental health, relationships, things like that. So that could be a challenge. So increasing that student engagement. Be prepared if an overdose occurs on your school rounds. Nursing staff at the schools know how to use naloxone. And so if you would like to get trained, you can ask your nursing staff. There's also coalitions and organizations at the county level that might also be able to do this. You can contact your local health departments. They might do this as well. So, so there are ways to get trained in how to respond to an opioid overdose. And then provide supports to students in recovery. So students who might be in recovery, they might be in families where the families are in recovery. In that case, the students are as well. It's a whole family. It's a family thing, right? So it's not just the one person, but if the one person is in recovery, usually that entire family is going through that as well, and in recovery as well. So providing supports to those students. And again, there are a lot of community level resources that can provide those supports and those resources that you can share as well. Okay. Next. Okay. And then that's it for me. I'm going to turn it back over to Ashley, and she's going to finish out with sharing these resources that we have.
Thanks, Gabby. And we wanted to give you an overview of some of the resources. There are so many out there. This is not an all exhaustive list. And I know it can be kind of overwhelming if this is your first exposure to how much is really out there to support you, but there's a lot out there. Another good thing is to just start by sharing what you've learned today and talk to people around you, and continue to do that, and know that there are lots and lots and lots of places that have information, support, evidence-based preparation and tools and things that have already been done. So you're not starting from scratch. So some of the national resources for professionals are the What Works and What Doesn't prevention tools, the School Resources Operation Prevention link, Ages and Stages of Youth Development that Gabby mentioned. The U.S. Department of Education has a site specific to opioids, Growing Up Drug-Free. And then also fentanyl awareness and the DEA. We've mentioned the DEA a few times. They have a few different campaigns going on that are really helpful for understanding and being aware of fentanyl. And then the Opioid Response Network. And I think a lot of these links will take you and can get you continuing down, right, the path of learning more. So we just encourage you to, start where you're at today and grow from there. So another thing that we have, I'm going to let Erin talk a little bit about this, is the additional information from the DEA.
Yeah, perfect. Thanks. We just wanted to highlight one thing, especially for teachers. So the DEA has this Operation Prevention website, and they have a few activities you can just integrate into your class schedule if anyone on here is teachers. So this is two things from their website. There's an activity calling Identifying Counterfeits. So right now, unfortunately, with fentanyl so cheap to make, and with illicit drugs, a lot of them are contaminated with fentanyl. So if you're buying those from drug dealers or online, chances are you're increasing your risk for overdose. So there's this short activity. How do you identify counterfeits? They watch this video, do a little activity. Then the one on the right is you can have your class come up with a community awareness campaign. Like, how would you help your community identify and stop purchasing or the impact of counterfeit drugs? So you have them develop their own, the students. So these are two good examples from that website, and all these resources have good examples And like we pointed out, these are across the spectrum, right? We highlighted SEL because that is something we believe in doing. And unfortunately, a lot of our time and money has been spent on overdose prevention instead of, preventing people from starting using medications or illegal substances in the first place. So this is just one good resource. Now, pass it back to you, Ashley.
Thanks, Aaron. And if we're looking at national resources, you also have a Prevention Technology Transfer Center Network, PTTC. I'm not going to keep saying that whole thing because it's too much. In your region, right? So there are national and regional resources for professionals, depending on what exactly the topic is that you're looking for, right? Maybe the issue that you're finding in your local area isn't fentanyl, maybe it's vape or other substances that are kind of the more cognizant ones that people are wanting to look at. And so we wanted to highlight that there are resources for all different types of substances, not just opioids. And so look at your local PTTC network. This is just a quick map of the prevention one. There's also there's an opioid technical assistance center, there's an addiction technology transfer center, there's a mental health technology transfer center. So there are different areas as well that you have lots of support at your fingertips online. And then I highlighted this one because I think it's really cool. There's a school-based mental health program through the mental health one that they provide some school-based mental health programming and ideas and resources for, which if we're looking at all of these things, I hope one of the things that is coming across that we're sharing today is prevention is key in supporting student development and resilience, and building positive relationships is really important for even, all students, but particularly youth who are at risk, and communities as well. It's not just students, it's everybody that's involved in prevention, treatment, and recovery, right? It's all connected. And so we just wanted to make sure that that was the thing that's standing out. So you have a lot of resources regionally. And then if you happen to be from the state of Utah, we wanted to provide some Utah specific resources for professionals, just because we know there's a lot of really great resources here, that you probably have great resources in your state as well. But these are just a few examples of some, Know Your Script, Parents Empowered, Utah Naloxone, Stop the Opidemic. The Utah County Red Ribbon Week has a lot of great information in it, some on social emotional learning as well. And USU Be Epic, Escape the Vape, and the Heart Initiative, and the Tribal and Rural Opioid Initiative. We have some links. Again, these are not all of the resources that are out there, just a brief list to get you started on this path to learning more. And then I think it's important to continue to learn more, right? Don't stop here, don't stop today. There's lots more to learn and to share and to do. And even, if you are like, I'm not going to use this in my professional life, you can also attend local take back days twice a year. The DEA does national campaigns in April and October every year to take back prescription medications, so they're not getting into the wrong hands. Usually they're done through law enforcement and other community partners in each community or in your state, but you also have access to dropping off medications anytime. 50% of people that use an opioid that's not prescribed to them is given to them by a friend or found in a home. So that's over half of the people who are using those. So get medications out of your house, right? Do things that help your local community, and look into your local coalitions. So if we're taking it even closer to home than the state that you live in, reach out to your local community. A lot of communities have Communities That Care coalitions that focus on prevention and are youth focused, but there's other coalitions as well. So find what you're passionate about and give back to your community. I know coalitions are often looking for more participation and involvement, so they would be probably pretty happy to have you reach out. And then if you do have specific questions, we are happy for you to contact us. And I'm just going to pass it back to Gabby because I know she has some more to share, but we just wanted to have our contact information here as well.
Oh yeah, just to kind of say that we have our contact information here. Feel free to reach out to any one of us. We put our counties in here, and obviously if you don't live in Utah, then the counties don't really make sense or whatever, but just, I I work in an urban county. Carbon and Emory counties are more rural. Aaron is more statewide. He's at the Logan campus up, at the on the main campus in northern Utah, but he also works statewide. And Ashley and I actually do stuff statewide as well as part of the HEART initiative. We kind of work cross counties, but these are the counties that we focus on. So feel free to reach out to us if you want to know more about the HEART initiative. Then we have all of our little cool social media handles that you can access. We have a YouTube playlist where we have Heart Bunch videos, and we do these educational videos on different topics. You can go to our website. We have a lot of different resources, campaign materials, we have just different things activities that we've done, and also fact sheets if you're looking at data and things like that. Then we have a lot of different resources over there as well. And that is our plug for ourselves. And we have our references here. I know there have been questions in the chat about, can you share the links and all that stuff. So thank you. I think we've been putting the links in there as we can, but they'll be clickable in PDF form. And that is a horrible cop out of not putting the links in there, but really we provided a lot of links. So 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 we could share the PDF version of this, and then all of the links are going to be clickable, and you can access all of those resources. So but our references are there as well if you're looking for references and kind of where we got the information and follow up like that. So we really appreciate your time. We do have time for questions, I think. So we will just open it up to questions, and we'll kind of pass it back to Jessica.
Absolutely. Thank you so much, Gabby. Please feel free to type any questions you have in the chat. You can raise your hand if you want to ask the question live. We did also put a link in the chat for the survey that I mentioned at the beginning. We would sure appreciate your feedback on that. And it looks like we are starting to get some questions in the chat.
Yeah, this last one that I've seen a couple of times. Do we have any translated materials regarding fentanyl? So specifically in Dario Frastel. We don't, like Utah. I don't. Well, I mean, at least like the USU does not. But does anybody have anybody on the webinar can answer that? We can look online to see, if there are materials that are translated into these languages and other ones, but I'm not aware of any right now. Okay. Yeah. Yeah, I'm sorry that, and if there's material that like we found ourselves, if there's material that we wanted translated in a specific language that wasn't available online or through any other state, we did try to work with our local coalitions or volunteers or others who are fluent in those languages and would be able to help translate. You might also have at the university level, at the universities, maybe even going through extension, finding folks at the universities who would be able to help as well. So, or even students in college. So yeah, there might be some opportunities, but it might take a little bit of extra time. So sorry, I couldn't give you a better answer, Taylor.
That's okay. I appreciate it. I was just trying to crowdsource. We do have a language team here at UDHHS and the refugee resettlement team, which is where I'm originally coming from, does have some funding for translation of materials, but just wanted to crowdsource.
Nice.
Yeah.
Very cool. And that might be really helpful for other communities and other states as well. So
absolutely. If and when those I'll say when those materials are developed, I'd be happy to share or pass along to Jessica to share to everybody.
Nice. Thanks, Caitlin. Were there any questions that up at the very top that we did not answer? I think Erin and Ashley and I tried to answer some questions along the way when we were talking, but was there anything any question anybody had that we didn't answer in all of this information that was provided?
Erin, do you want to take that question? I know you answered it in the chat above. The question is if you should not give rescue breaths because fentanyl could transfer
Yeah,
you.
yeah, I could answer that. So the likelihood of that is extremely, extremely rare. I don't want to say it could never happen, but either way, we really recommend just doing the chest compressions only until EMS arrives, unless you've been trained in CPR and have some sort of barrier or mask, not only for the potential risk for, you know, substances, but more infectious diseases. So with COVID and things, we don't want you to get infected and that. And the research is super strong that chest compressions only is very effective. So that's what we recommend.
Yes,
Yeah.
a very important question for sure.
Yeah, of course. And again, I mean, like I said, we've been answering questions, but honestly, as people have been jumping on and off, if, you know, if there was anybody had questions that they wanted to repeat or have us specifically say out loud, then just so everybody hears it, then we'd be happy to address those questions again as well. So yeah, gloves and masks are great as well. Honestly, they're helpful. Any of that personal protective equipment, any of those barriers that are helpful. I think for any lay person, again, kind of looking at those chest compressions is really helpful and effective. But if you can give rescue breaths and you feel comfortable, you know, go ahead.
Okay, well, it looks like we are caught up on questions. Thank you all so much for coming today. Anyone that was registered for this webinar will be sending a follow-up with the recording as well, along with the slides. And then we will be sure we won't add you to our mailing list unless you request it, but we will go ahead and include you on the invite for the second part of this series at least. And you can sign up for our newsletter. That newsletter link is a little bit up in the chat, and that would be, you'd also receive any event announcements if you do sign up. And I saw that we had a few come through already. We sure appreciate it. Thank you so much, Gabby and team, for joining us. And thank you all for coming today. And we will hopefully see you in a few weeks.
Everyone.
Thank you.
And happy Friday.